Question 1. Which of the following exposure factors primarily controls the quantity of X-rays produced? A. Kilovoltage peak, kVp. B. Milliampere seconds, MOS. C. Source to image receptor distance, SE-day. D. Object to image receptor distance, OE-day. Answer, B. Milliampere seconds, MOS. This question tests your understanding of how exposure factors influence the X-ray beam. The key term quantity refers to the number of X-ray photons produced. Milliampere seconds, MOS, directly controls the number of electrons boiled off the filament and thus the total number of X-ray photons generated at the anode, which in turn determines the overall density or brightness of the image. For instance, if you need a darker image, you would increase the MOS. Always remember that MOS directly relates to the quantity of radiation and, consequently, the radiographic density. Question 2. What is the primary purpose of using a grid in general radiography? A. To reduce patient dose. B. To improve spatial resolution. C. To absorb scatter radiation. D. To increase beam penetration. Answer, C. To absorb scatter radiation. This question focuses on the function of an essential accessory in radiography, the grid. The main purpose of a grid is to enhance image contrast by removing unwanted scatter radiation before it reaches the image receptor. Scatter radiation is produced when the primary X-ray beam interacts with the patient, and it degrades image quality by adding unwanted fog. For example, when imaging a thick body part like the abdomen, a grid is crucial to absorb this scatter, leading to a much clearer diagnostic image. A helpful tip is to associate grids with cleaning up the image by reducing scatter. Question 3. According to the ALARA principle, what is the most effective method for reducing occupational radiation exposure? A. Decreasing kVp. B. Increasing MOS. C. Increasing distance from the source. D. Using faster image receptors. Answer, C. Increasing distance from the source. This question assesses your knowledge of radiation safety, specifically the ALARA principle, which stands for as low as reasonably achievable. The most effective method for occupational dose reduction among the choices provided relates to the inverse square law. Increasing your distance from the radiation source significantly reduces your exposure, as the intensity of radiation decreases rapidly with increased distance. For example, stepping back twice the distance from a patient during an exposure reduces your exposure to 1/4. Always prioritize maximizing distance, using shielding, and minimizing exposure time to practice ALARA effectively. Question 4. Which anatomical structure is best visualized on an AP, anteroposterior, projection of the knee with the patient supine and the leg fully extended? A. Patella superimposing the femoral condyles. B. Open tibiofemoral joint space. C. Fibular head free of superimposition. D. Lateral femoral condyle clearly defined. Answer, B. Open tibiofemoral joint space. This question tests your understanding of basic radiographic positioning and anatomy for the knee. The AP projection of a fully extended knee aims to demonstrate the weight-bearing surfaces and the relationship between the tibia and femur. With the knee extended, the primary goal is to visualize the tibiofemoral joint space without significant overlap, which is crucial for assessing conditions like arthritis. For instance, if a patient has osteoarthritis, a clear AP view helps determine the degree of joint space narrowing. Remember that proper positioning is key to achieving a diagnostic image that accurately represents the anatomy. Question 5. What is the primary function of the anode in an X-ray tube? A. To emit electrons. B. To produce thermionic emission. C. To provide a target for electron interaction. D. To house the filament. Answer, C. To provide a target for electron interaction. This question delves into the fundamental components of an X-ray tube. The primary function of the anode is crucial to X-ray production. The anode serves as the target where the high-speed electrons from the cathode are suddenly decelerated, converting their kinetic energy into X-rays and heat. For example, the rapid deceleration of electrons striking the anode's tungsten target is what generates the diagnostic X-ray beam. Think of the anode as the stopping point for electrons, where the magic of X-ray creation happens. Question 6. What is the appropriate action to take immediately after an accidental needle stick injury? A. Report the incident at the end of the shift. B. Squeeze the wound to promote bleeding. C. Wash the affected area thoroughly with soap and water. D. Apply a sterile bandage and continue working. Answer, C. Wash the affected area thoroughly with soap and water. This question addresses critical infection control and safety protocols for healthcare professionals. In the event of an accidental needle stick injury, the immediate and most crucial step is to thoroughly wash the puncture site with soap and water for several minutes to help remove potential contaminants. This initial action is a first-line defense against infection, followed by reporting the incident according to facility policy. For example, this immediate washing helps to reduce the viral load if the needle was contaminated with blood-borne pathogens. Always prioritize immediate wound care and follow-up reporting for any sharps injury. Question 7. A radiograph of a chest shows excessive density, making the lung fields appear too dark. Which adjustment to the exposure factors would most likely correct this issue on a repeat image? A. Increase KVP. B. Decrease MOS. C. Increase SID. D. Decrease OID. Answer, B. Decrease MOS. This question tests your ability to troubleshoot common image quality issues, specifically relating to radiographic density. When an image has excessive density and appears too dark, it means too many X-ray photons reached the image receptor. Milliampere seconds, MOS, directly controls the quantity of X-rays and thus the radiographic density. To lighten a dark image, you would need to decrease the MOS, reducing the overall exposure. For instance, if an initial chest X-ray was taken at 5 MOS and was too dark, repeating it at 2.5 MOS would result in a lighter image. Remember that MOS is your primary control for adjusting image darkness or brightness. Question 8. Which of the following best describes the principle of operation for a computed radiography (CR) system? A. X-rays directly convert to electrical signals in a flat panel detector. B. X-rays interact with a photostimulable phosphor plate, storing energy that is later read by a laser. C. X-rays are converted to light by a scintillator, then captured by a CCD. D. X-rays expose a silver halide film, which is chemically processed. Answer, B. X-rays interact with a photostimulable phosphor plate, storing energy that is later read by a laser. This question examines your understanding of digital imaging technologies, specifically computed radiography, CR. The principle of operation for CR involves an imaging plate containing photostimulable phosphors that absorb X-ray energy and store it as a latent image. This stored energy is then released as light when scanned by a laser in a CR reader, which is subsequently converted into a digital signal. This process is similar to how a cassette is exposed and then developed digitally. Thinking of CR as a cassette-based digital system helps clarify its two-step image acquisition and processing. Question 9. In what position should a patient be placed for an AP, anteroposterior, projection of the lumbar spine to best demonstrate the intervertebral joint spaces? A. Prone with knees extended. B. Supine with hips and knees flexed. C. Upright with lateral flexion. D. Oblique with rotation. Answer: B. Supine with hips and knees flexed. This question focuses on optimal patient positioning for a specific anatomical area, the lumbar spine. To best demonstrate the intervertebral joint spaces on an AP lumbar spine projection, it is essential to reduce the natural lordotic curve of the lumbar spine. Flexing the hips and knees while supine achieves this by tilting the pelvis and flattening the lumbar lordosis, allowing the X-ray beam to pass more perpendicularly through the disc spaces. For example, if a patient has disc degeneration, this position provides the clearest view of the affected spaces. Remember that positioning adjustments are often made to align anatomy more favorably with the X-ray beam. Question 10. What is the primary reason for using a high kilovoltage peak, kVp, technique in chest radiography? A. To increase patient dose. B. To reduce scatter radiation. C. To penetrate the mediastinum and visualize lung markings. D. To enhance bone detail. Answer: C. To penetrate the mediastinum and visualize lung markings. This question explores the application of exposure factors in specific anatomical imaging, focusing on chest radiography. The primary reason for using a high kVp technique, typically 100 to 125 kVp, in chest imaging is to achieve adequate penetration through the dense mediastinal structures, like the heart and spine, while maintaining sufficient contrast in the lung fields. This allows for better visualization of subtle lung pathologies and bronchial markings. For instance, a low kVp image might burn out the lung fields or underpenetrate the mediastinum, obscuring critical diagnostic information. High kVp for chests helps you see through the heart. Question 11. Which of the following is considered a primary method of infection control in medical imaging? A. Proper patient scheduling. B. Hand hygiene. C. Use of lead shielding. D. Documenting patient history. Answer: B. Hand hygiene. This question highlights a fundamental aspect of patient and healthcare worker safety, infection control. Among the options, hand hygiene, washing hands or using alcohol-based sanitizer, is universally recognized as the single most effective primary method for preventing the spread of infection in any healthcare setting. Regular and thorough hand washing breaks the chain of infection by removing transient microorganisms. For example, performing hand hygiene before and after every patient contact significantly reduces the transmission of bacteria and viruses. Always remember that clean hands are your most powerful tool against infection. Question 12. What is the purpose of image archiving in a picture archiving and communication system, PACS? A. To perform image processing. B. To provide long-term storage and retrieval of images. C. To convert analog images to digital format. D. To adjust image brightness and contrast. Answer: B. To provide long-term storage and retrieval of images. This question tests your understanding of a key component in modern digital radiology. PACS. The purpose of image archiving within PACS is its core function, to securely store medical images, like X-rays, CTs, MRIs, for extended periods and allow for their efficient retrieval when needed for diagnosis, comparison, or legal requirements. This eliminates the need for physical film storage and makes images readily accessible across different departments. For instance, a radiologist can quickly pull up a patient's previous chest X-ray from years ago for comparison with a current study. Think of archiving as the digital library for all patient images. Question 13. Which type of radiation monitoring device is commonly used for long-term personnel monitoring in medical imaging? A. Geiger-Müller counter. B. Ionization chamber. C. Optically stimulated luminescence, OSL, dosimeter. D. Scintillation detector. Answer, C. Optically stimulated luminescence, OSL, dosimeter. This question asks about devices used for occupational radiation dose monitoring. An optically stimulated luminescence, OSL, dosimeter is a widely used and highly sensitive device for long-term personnel monitoring. It contains aluminum oxide that stores energy from radiation exposure and releases it as light when stimulated by a laser, which is then measured to determine the dose. For example, MRTs typically wear OSL dosimeters monthly or quarterly to track their cumulative radiation exposure. Remember, OSL dosimeters are the standard for tracking cumulative dose due to their accuracy and ability to be reread. Question 14. A patient arrives for a shoulder X-ray after a fall. What is the most important initial question to ask before proceeding with the examination? A. Are you currently taking any medications? B. What is your date of birth? C. Can you tell me which shoulder hurts and where exactly it hurts? D. Have you had this type of injury before? Answer, C. Can you tell me which shoulder hurts and where exactly it hurts? This question addresses a critical aspect of patient communication and procedural safety in medical imaging. When a patient presents with an injury, the most important initial question is to accurately identify the specific area of complaint. This ensures you are imaging the correct body part and helps localize the region of interest for the radiologist, preventing errors. For example, if a patient says my shoulder but points to their collarbone, clarifying the exact pain location is vital before positioning. Always confirm the exact site of pain or injury to ensure you are performing the correct and relevant examination. Question 15. What is the primary component responsible for focusing the electron stream towards the anode in an X-ray tube? A. Filament. B. Stator. C. Focusing cup. D. Rotor. Answer, C. Focusing cup. This question delves into the intricacies of X-ray tube design and function. The focusing cup is the crucial component that surrounds the filament and has a negative charge, which electrostatically repels the electrons emerging from the heated filament, narrowing them into a tight beam directed toward the anode's focal spot. Without the focusing cup, the electron stream would spread out, resulting in a blurred image. For instance, imagine trying to hit a small target without aiming. The focusing cup is like the aim for the electron beam. It's essential for achieving good spatial resolution by creating a small focal spot. Question 16. During a fluoroscopic procedure, what is the primary method used by the radiographer to minimize patient radiation dose? A. Using a grid. B. Increasing MA. C. Limiting beam on time. D. Increasing image magnification. Answer, C. Limiting beam on time. This question focuses on radiation safety specifically within fluoroscopy. The primary method for minimizing patient dose during fluoroscopy is directly related to the duration of radiation exposure. Limiting the beam on time, or using pulsed fluoroscopy, significantly reduces the total amount of radiation delivered to the patient because dose is directly proportional to exposure time. For example, a fluoroscopy procedure that takes 60 seconds of beam-on time will deliver twice the dose of a 30-second procedure. Always be mindful of the fluoro time as it is the most controllable factor for patient dose during dynamic imaging. Question 17. Which of the following conditions would require a decrease in technical factors, KVP and/or MOS, from a standard technique? A. Ascites. B. Pleural effusion. C. Osteoporosis. D. Pneumonia. Answer: C. Osteoporosis. This question tests your understanding of how patient conditions affect radiographic technique. Osteoporosis is a condition characterized by a decrease in bone density, meaning the bones are less dense and absorb less X radiation. Therefore, less radiation is required to penetrate the patient and produce an adequate image receptor exposure. For example, if a standard technique is used on an osteoporotic patient, the resulting image would appear overexposed, too dark. Remember that conditions causing bone demineralization or decreased tissue density generally require a reduction in exposure factors. Question 18. What is the primary advantage of using digital radiography, DR, over computed radiography, CR? A. Lower initial equipment cost. B. Increased portability of detectors. C. Immediate image display. D. Reduced need for processing algorithms. Answer: C. Immediate image display. This question compares two digital imaging modalities. The primary advantage of direct digital radiography, DR, over computed radiography, CR, is the speed of image acquisition and display. DR systems directly convert X-ray energy into a digital signal, allowing for near-instantaneous viewing of the image on a monitor, which significantly speeds up workflow. For example, in an emergency room, the ability to see a trauma image within seconds after exposure is a huge benefit for patient care. DR offers instant feedback and faster patient throughput compared to the cassette-based CR system. Question 19. When performing a lateral chest X-ray, which anatomical structure should be clearly visible without significant superimposition? A. Both hemidiaphragms. B. Trachea. C. Sternum. D. Ribs in superimposition. Answer: A. Both hemidiaphragms. This question assesses your knowledge of proper positioning for a common projection, the lateral chest X-ray. For an accurately positioned lateral chest X-ray, both hemidiaphragms, the right and left sides of the diaphragm, should be clearly visible and superimposed or nearly superimposed. This indicates that the patient was positioned without rotation, which is crucial for evaluating lung fields and underlying structures. For instance, if the hemidiaphragms are not superimposed, it indicates rotation that could obscure pathology. Ensuring the hemidiaphragms are aligned is a key indicator of a good lateral chest position. Question 20. What is the recommended minimum lead equivalency for protective aprons used in fluoroscopy? A. 0, 25 mmPb equivalent. B. 0, 5 mmPb equivalent. C. 1, 0 mmPb equivalent. D. 1, 5 mmPb equivalent. Answer: B. 0, 5 mmPb equivalent. This question tests your knowledge of radiation protection standards, specifically for personal protective equipment. The recommended minimum lead equivalency for protective aprons used in fluoroscopy, where exposure times can be longer and doses higher, is 0, 5 mm lead equivalent. While 0, 25 mmPb is acceptable for general radiography. The increased exposure in fluoroscopy necessitates thicker shielding. For example, wearing a 0.5 mmPb equivalent apron provides substantial attenuation of scatter radiation, protecting vital organs. Always choose appropriate shielding based on the expected radiation exposure level to ensure your safety. Question 21. What is the best way to prevent motion blur on a radiograph of a pediatric patient? A. Increase SID. B. Use a higher KVP. C. Use a short exposure time. D. Decrease MOS. Answer, C. Use a short exposure time. This question focuses on managing image quality in challenging patient populations, specifically pediatrics. To prevent motion blur in pediatric patients, who may struggle to hold still, the most effective strategy is to use the shortest possible exposure time. A short exposure time freezes involuntary or voluntary motion, preventing the blurring of anatomical structures. For example, using a high MOS station to achieve the desired MOS in a very short time helps capture a clear image of a wiggly child. Always prioritize reducing exposure time to minimize the impact of patient motion, especially with uncooperative patients. Question 22. Which plane divides the body into anterior and posterior, front and back, portions? A. Sagittal plane. B. Coronal, frontal, plane. C. Transverse, axial, plane. D. Oblique plane. Answer, B. Coronal, frontal, plane. This question assesses your fundamental understanding of anatomical planes. The coronal, frontal, plane is defined as any vertical plane that divides the body or an organ into anterior and posterior, front and back, sections. This is a crucial concept for understanding radiographic projections and cross-sectional imaging. For example, a lateral chest X-ray visualizes the chest along a coronal plane. Knowing these planes helps you accurately describe and orient anatomical structures in medical imaging. Question 23. What is the primary concern when a patient with a history of severe allergic reactions is scheduled for a contrast-enhanced CT scan? A. Risk of claustrophobia. B. Need for a detailed medical history. C. Potential for an adverse reaction to the contrast media. D. Difficulty in obtaining venous access. Answer, C. Potential for an adverse reaction to the contrast media. This question highlights critical patient safety considerations, particularly concerning contrast media. For a patient with a history of severe allergic reactions who is scheduled for a contrast-enhanced CT scan, the primary concern is the increased risk of an adverse reaction to the iodinated contrast media. These reactions can range from mild, hives, to severe, anaphylaxis. For example, screening patients for allergies and potentially pre-medicating them is vital to prevent life-threatening responses. Always prioritize patient safety by thoroughly screening for allergies and preparing for potential contrast reactions. Question 24. A radiograph of the hand shows blurred bony detail, but soft tissue is clear. What is the most likely cause of this image quality issue? A. High KVP. B. Insufficient MOS. C. Motion of the hand. D. Overpenetration. Answer, C. Motion of the hand. This question tests your ability to identify the cause of specific image quality issues. When bony detail is blurred but soft tissue is clear, it strongly suggests that there was patient motion during the exposure. Bones are denser and require a longer exposure time to achieve clear detail than soft tissues, making them more susceptible to motion blurring if the patient moves. For example, if a patient slightly wiggles their fingers during a hand X-ray, the bone outlines might appear fuzzy while the overall soft tissue appearance remains relatively sharp. Remember that motion blur is often characterized by a loss of sharpness in the affected structures. Question 25. Which post-processing technique allows for the adjustment of image brightness and contrast on a digital image display? A. Stitching. B. Windowing. C. Magnification. D. Edge enhancement. Answer: B. Windowing. This question refers to essential post-processing capabilities in digital imaging. Windowing is the post-processing technique that specifically allows the radiographer or radiologist to manipulate the brightness and contrast of a digital image on a display monitor. The window level adjusts brightness, and the window width adjusts contrast. For instance, adjusting the window settings allows a radiologist to optimally visualize lung tissue on a chest X-ray and then switch to different settings to evaluate the bony thorax on the same image. Mastering windowing is crucial for extracting maximum diagnostic information from digital images. Question 26. What is the term for the process where X-ray photons interact with matter and change direction? A. Absorption. B. Transmission. C. Scatter. D. Attenuation. Answer: C. Scatter. This question asks about the different ways X-ray photons interact with matter. Scatter is the term that specifically describes the interaction where an X-ray photon changes its direction after interacting with an electron, losing some of its energy in the process. This scattered radiation often contributes to image fog and patient dose. For example, Compton scatter is a common interaction that produces unwanted scattered photons that can reach the image receptor. Understanding scatter is vital for both image quality and radiation protection. Question 27. What is the primary purpose of collimation in radiography? A. To improve image contrast. B. To reduce patient dose. C. To control focal spot size. D. To increase beam intensity. Answer: B. To reduce patient dose. This question addresses a fundamental principle of radiation protection and image quality. The primary purpose of collimation is to restrict the size of the X-ray beam to only the area of interest, thereby reducing the volume of tissue irradiated and significantly lowering the patient's radiation dose. As a beneficial side effect, it also reduces scatter radiation, which improves image contrast. For example, collimating tightly to a hand for a wrist X-ray minimizes exposure to the rest of the arm and body. Always remember that proper collimation is a crucial first step in practicing ALARA. Question 28. Which projection is commonly used to demonstrate the coronoid process and radial head of the elbow free of superimposition? A. AP elbow, partial flexion. B. Lateral elbow. C. AP oblique elbow with medial, internal, rotation. D. AP oblique elbow with lateral, external, rotation. Answer: C. AP oblique elbow with medial, internal, rotation. This question tests specific anatomical positioning for the elbow. To effectively visualize the coronoid process and radial head free of superimposition in the elbow, an AP oblique elbow with medial, internal, rotation is typically performed. This specific rotation projects these structures laterally, away from the humerus, allowing for clear assessment. For instance, if a patient has a fracture of the coronoid process, this view is essential for proper diagnosis. Precise positioning, including specific rotations, is often necessary to isolate and demonstrate particular anatomical features. Question 29. What is the main reason for routinely performing two projections 90 degrees to each other for most anatomical areas? A. To decrease patient discomfort. B. To reduce the likelihood of motion blur. C. To visualize anatomy in 3 dimensions and localize pathology. D. To increase the speed of the examination. Answer C. To visualize anatomy in 3 dimensions and localize pathology. This question addresses a core principle of diagnostic imaging. The main reason for obtaining two projections 90 degrees to each other, e.g., AP and lateral, for most anatomical areas is to provide a comprehensive, 3-dimensional view of the structures and to accurately localize any pathology, such as fractures or foreign bodies. A single view can conceal or distort information. For example, an AP projection might show a fracture, but a lateral view reveals its displacement. Always remember that multiple views from different angles give the radiologist a complete picture. Question 30. Which quality control test is used to assess the accuracy of the X-ray beam's central ray alignment? A. Reproducibility of exposure. B. Beam filtration check. C. Collimator light field and X-ray field congruence. D. Linearity of exposure. Answer C. Collimator light field and X-ray field congruence. This question explores a specific aspect of quality control in radiography. The collimator light field and X-ray field congruence test is performed to ensure that the visible light field, which indicates the area of radiation exposure, accurately matches the actual X-ray beam field. If these do not align, parts of the anatomy could be missed, or unnecessary patient tissue could be irradiated. For example, if the light field is significantly smaller than the X-ray field, important anatomy might be excluded from the image. Regular congruence checks are vital to minimize dose and ensure proper image coverage.